Hello, everybody. I hope you guys can all hear me out there in webinar land. I'd like to thank you for taking the time to join me on probably a busy schedule for most of you out there. I'm not sure what time it is out there for everybody. For me, it's 4 o'clock in the afternoon, and yeah, just wrapping up here a day of work, and so it's nice to be able to sit down and spend a little bit of time with everybody and hopefully teach you a few new pearls and some wisdom on how to handle improving the Class 2 restorative restoration. So thanks again, and as you know, you can always submit questions, and we'll do our best to get to those at the end of the show here. Plan on going about 50 minutes with about 10 minutes of question and answer at the beginning. So as you know, I hail, or maybe you don't know, but I hail here from the Bay Area. Not exactly San Francisco, but I'm about 25 miles east of San Francisco, in the wonderful city of Walnut Creek, California. So those of you that are out there have probably been here and understand that it's a nice place. I apologize for my voice a little bit. It's a bit scratchy today. We've had a lot of unseasonable rainfall this year, which is very good for the drought-stricken California. But what comes that is a lot of allergies and a lot of stuffiness. So hopefully I'm coming through nice and loud and clear, and here we go. But first of all, I'd also like to shout out a little special thanks to Microbrush International, as well as Kerr for sponsoring our program this evening. It's without companies like these that dental education doesn't continue to thrive in the fashion that it does. So thank you all for your continued support and increasing our knowledge base and providing optimal patient care. Thank you so much for your contributions. Okay, so you're probably asking yourself, why are we going to focus on a Class 2? What's so important about a Class 2, and why? In simple sense is basically because 45% of our restorations that we do today in dental practice are a Class 2 restoration. Very meat and bread and butter potatoes of our practices, and so it's one of those things that we definitely need to come to an understanding and make itself more of a simplistic type situation, make things easier ourselves. For me, it's not necessarily doing it as fast as I can, but for me, it's doing it as fast as I can and most predictable. Predictability is definitely a very difficult situation when dealing with Class 2s. For instance, a situation like this, a preparation that a lot of you probably see on a day-to-day basis, where you have multiple box preparations, one significantly deeper than the other, and the predictability really is a challenge. Am I going to restore that tooth in a predictable fashion that's going to provide a long-lasting restoration? So when we talk about Class 2s, I mean, obviously the challenges we face as clinicians come down to a couple things, a lot of things actually. One of the major things is isolation from the hostile environment. We deal in a very difficult environment on a day-to-day basis, and I think we can all attest to that it's not an easy job what we do in terms of fixing teeth. So isolation is a very critical part of what we do. Next very critical part of things we do is getting that sectional matrix into place. Like that prior picture I showed you, it's very difficult to get that sectional matrix in place, get it isolated to the point that allows us to seal that matrix at the gingival margin, generally the most critical area, the deepest aspects of that box preparation, where a majority of our restorations fail. That is the bare bones basic breakdown principles in a Class 2 is in the deepest part of that gingival margin. Sealing the line angles in the box, making sure we have a material that's adaptable, something that flows into those crevices and nooks and crannies. Creating the ideal hybrid layer. We'll talk a little bit later about some of the bonding agents out there today, but creating the ideal hybrid layer is certainly the backbone of any predictability and successful restoration. Proper light curing. Unfortunately, we're not going to go over that too much tonight, but in my point of view, this is definitely one of the areas in dentistry that certainly we need to spend a little bit more time and make sure that a lot of our restorations that we're doing today are being adequately cured. Not necessarily sure that's true on a day-to-day basis, so curing lights are very important. Achieving an ideal contact. That's one of the biggest complaints when people talk about doing posterior composite resin restorations, is they have a real difficult time achieving contact. Open contacts we know are very distressful to the patient, very distressful to us, a very non-profitable situation as we find ourselves replacing those. And a lot of times people don't use that proper contact situation or create the ideal contact situation just simply on materials and properties, and we'll talk about that today here as we move along. Proper finishing and polishing, very important as far as accumulation of plaque, the biofilm removals, all those necessary things that are definitely an essential portion of our Class 2 restoration. But first of all, let's talk a little bit about isolation and how important that is. So isolation in any restoration that requires the minimal invasiveness of water, humidity, perspiration into that area, isolation has to be forefront in our minds. As we all know, the gold standard has been for a long period of time is the rubber dam. Am I here to say it's not the gold standard anymore? Absolutely not. I still think a rubber dam is definitely where the bar should be set in terms of adhesion dentistry and doing adhesive dentistry in a controlled environment. I personally use isolites a lot. I use that system because of just the ability of my patient adaptation to it and the overall effect that I get with it and the ease and the comfort of it. And I think we can really say to ourselves that maybe it's not the gold standard of a rubber dam, but it's pretty darn close in terms of how well it works in certain situations. But the one question that's really never talked about is what about when that gold standard's not met? I don't know about you guys, but in my dental practice, there's many a times that I have patients that will not allow me to do a rubber dam and they will not allow me to do an isolate. Now, that's certainly a topic of conversation that we could get into in terms of the ethics and the rights and the wrongs. But a lot of the times we have patients that won't allow that, and it's our job to serve our patients to the best of our abilities. So when the gold standard can't be met, what are we relying on? You know, most of the time we're relying on cotton rolls. Cotton rolls have been around for a long period of time. They're easy, they're quick accessible, they're relatively cheap to buy. And the bottom line is we just end up using way too many when we talk about using them for an isolation. They're constantly getting wet. They need replacement time and time again. They don't stay in place very well once they become wet. And they don't protect very well also. Generally, one of the nicer things about rubber dams and isolates is that a lot of times it pushes the cheek and the tongue and everything out of the way to the point we don't have to worry too much about catching that into the burr, the rotary instruments that we may be using. So for me, I've come on to a couple other new things that I've really started to enjoy, and those are dry tips by Microbrush. And they come in some various formulas, but basically one type of application they have is called a dry aid. It's a little bit different, a little bit more of a paperish cardboard type effect, and comes in both a reflective surface as well as a non-reflective surface. And those tend to work really, really well for me for certain situations. I don't know any of you out there that may do a lot of air abrasion, a lot of micro preparation with a prep start or something in that category, but as we know, we still certainly get some overspray and a little bit of aluminum oxide buildup. And one of the things I found really nice for me is the non-reflective dry aid I use quite a bit. As it gets wet, it's very receptive to the adaptation of the soaking up of the aluminum oxide, kind of decreasing a little bit of the mess, not completely, but certainly helps protect the cheek from any type of abrasion, those various things. But as we've advanced and Microbrush has advanced, they've obviously increased their ability to use these dry tips, and dry tips is the next one in the formulation that they've came up with. And the dry tips is a really nice situation, very highly absorbent on the cheek side with a reflective, not reflective, but a bendable type material that allows to be manipulated with the cheek, gives you really wonderful access, as you can see in that photo taken right there. Advancements have continue to come along that line, and we come out with the dry tip reflective. One of the really nice things dry tip reflective is very similar to what you have with the dry tip itself, but now they've added a reflective surface for a little bit more in the terms of reflectability, a little bit more increased light to the area as it illuminates more off of your handpiece, as well as the overhead light, your loops, the various things that you may be using. But very nice situation to use in a reflective, giving you a little bit more increased vision. But the true advantage of these is basically the ability to use these in a lot of situations to control saliva. The biggest thing obviously is controlling that parotid gland, the very large parotid gland that's pumping out a lot of the saliva to give you a little bit more difficult work environment. Works well in the flexibility, accommodates the cheek movements, allows you to place your mirror onto that material, and a lot of bendability with the overall effect of not losing any of the overall absorbing factors. This will continue to absorb no matter how much manipulation and compression you're placing on that with the pushing, the pulling, the reflection of the cheek that may be going on. Ideal for a lot of different situations, patients that you have a tough keeping things dry and impressions, occlusal adjustments, composites, cementations. We use them a lot for our ability to do sealants, a lot of different things what we're doing. I do orthodontics here in the practice. It's really nice when I'm bonding posterior brackets to be able to have something that helps me control the environment to a much better point than it's been before. So what's really so great about these things is really, like I said before, is just the overall absorptive factors of this. Generally, I can place one dry tip or one dry reflective tip into my work area, and I can really account on that to withstand the whole procedure time. So I'm not wasting time changing out cotton rolls. It gives me a lot better protection, especially when I'm doing a preparation on a crown preparation on a buccal surface of number 2. It really does a nice thing, and it's got a really nice woven mesh material that helps reduce any post residue. It comes out very cleanly. Removal wise, you generally take your air water syringe, place it along that buccal surface, spray some water into it so you're not ripping the buccal mucosa or adhering any of the soft tissues as removing. But once in place, it stays in place throughout the length of your treatment time, which is really nice. You're not changing things, doing it over and over again. Went through Dental Product Shopper review recently, the dry tip reflectives, and as you can see, it scored a 4.8 out of 5, which for me is really a nice factor to see, a nice number to see in terms of they had a lot of users take a look at those, and definitely it's like I said, it's not a replacement for a rubber dam or an ice dry, but it certainly is a wonderful adjunct to have in your armamentarium in terms of increasing your ability to do things a little bit faster and more productive and getting a lot more done in a shorter period of time. Okay. Now the next big thing when we talk about class 2 restorative is we need to talk about how we're creating those contacts like we talked about earlier. And one of the big areas we need to talk about is what we would sectional matrix. Here's a few of the various components or companies out there today that are making sectional matrix, and they really do a nice job. Because really, if we take a look at it and kind of get an understanding of what the purpose of a matrix system is, the basics simply come down to we're trying to provide a proper anatomical contour. We're trying to recreate what we just took away with the decay process and the decay removal process in itself. Okay. We want to keep the restoration obviously from adhering to adjacent teeth. I mean, that's really the basic priority behind that. And the other thing being we also want to make sure that we're sealing all the cable surfaces while minimizing the flash. We want to be able to seal the areas once again into a controllable fashion that I don't find myself polishing and adjusting and doing a lot of recreating of the wheel architecturally in terms of I want something that's going to be relatively in place and easy to contour, once again minimizing my time chairside. Predictable. We do want something predictable. We want something that we know is going to work in most situations all of the time. Now, to say that sectional matrix or any situation where there's a sectional matrix or a Tafelmeyer or whatever, there's not one size fits all. There is certain times when things just don't work out depending on obviously the configuration of the teeth, the overall prep design. Some things don't work out all the time, but most of the time we should have a high predictability rate with the materials that we're using as well as the matrix systems. Okay, but the overall effect is we know that a poor matrix system can certainly lead to an open contact. What's the downside of open contacts is obviously they can create food impaction, which can lead to periodontal issues, bone loss, recurrent decay. An upset patient can't understand why they're getting food collection. Not a real practice builder for the most part, but the bottom line is it's a nuisance, and we want to make sure that we're decreasing the amount of redos we have in our practice, making sure we are doing things correctly and by the book. Okay, so let's do a little comparison for those that are using circumferential or the Tafelmeyer, as most people would call it, versus a sectional. So the biggest thing that you always find with a circumferential versus a sectional is simply how the design of the band comes out from the height of contour of the tooth, or the emergence profile, so to speak. With a circumferential band, you're always going to get a straight emergence profile coming from the gingiva, to the point that you're putting your contact point at the highest point of the marginal ridge. Whereas a sectional matrix, you're obviously anatomically, you're putting the contact point mid-tooth in the heart of the matter, where we can give ourselves a lot more feasibility in terms of strength. Here's a cross-section of just using through a typodont and what exactly that looks like when you're using a circumferential versus a sectional. Obviously on the right you can see the sectional that's obviously anatomically correct, placing the contact point in the middle portion of the tooth, distributing the stresses occlusally. The problem with circumferential is obviously with an occlusal situation where you have marginal ridge contact, your patient is more than likely going to chip that in a small area, which continues to increasing the openness in the area of creating an open contact. So less matter for the area in strength and support will give you definitely an open contact over time. Okay, flash, that's a big thing. Obviously with a sectional versus a Tafelmeyer is that the sectional is going to hug the tooth and give you less buccal lingual flash than you would in a Tafelmeyer or circumferential situation. You certainly will have some flash with a sectional matrix, there's no doubt about it. All teeth are anatomically a little bit different than the rest, but most of the time you want to see something like on the sectional matrix side, on that lingual side of a tooth in comparison to the buccal side, where you have minimal flash, very little polishing to do, something you could take in there with like an OptiDisc or even some type of polishing cup where you can just simply knock and smooth that ledge off in a relatively quick fashion. The overall bottom line is, again, like I said, being predictable and doing things in a relatively quick and easy fashion. So if we compare the problems of a Tafelmeyer versus a sectional matrix, okay, biggest thing on a Tafelmeyer side, you'll say it fails to restore proximal anatomy. Thin contact at that marginal edge, that's where you see the chipping, and you probably see this in your practice occasionally, where you have a thin marginal ridge and you get that open contact due to the microchipping and the fragments that begin to chip over time. The food trap begin to occur, and the overall ability for that contact to withstand any pressure and eventually fail and crack. The sectional matrix, on the other hand, gives you that nice naturally contoured sectional or contoured band, gives you the correct contacts, puts the height of contour in the correct space, and gives you a really nice overall contact. Then why is it said that roughly 70% of the clinicians find contact creation to be the most challenging part of a Class II restoration? So if we're using the sectional matrix and we're doing everything anatomically perfect and we're placing things in the correct situations that we would like to, then why are we having open contacts? Well, one of the big things is the ring. We haven't talked much about the ring and what the differentiating points of a ring system is, but generally what the ring is basically for the separation. An effective ring is going to allow separation between the teeth. As we know, stretching out the PDL ever so slightly, allowing our sectional matrix bands to be placed, removing that ring, allowing those PDLs to collapse back together will certainly give us a better contact in the long term by just PDL manipulation itself. But one of the things that's really interesting is the new microbrush, just showing a little bit of a comparison in some of the leading brands out there in comparison to the new microbrush Contact Pro ring that's out there. And simply what they did is they took a few of the leading brands out there and simply took the plier apparatuses to them and began to stretch and manipulate those over time. Very simply over a few times, only 5 to 10 compressions and decompressions of that material, and what the overall effect was simply a decrease in strength, or what we would call metal fatigue. So what's really a nice interesting point about this new Contact Pro ring system is that we have a new metal, and it's called nitinol. And so nitinol is a metal out there, but what Microbrush International has done so well is they've done a proprietary machinery of this nitinol metal. And what they've been able to do is manipulate it into the form of a ring. And a ring in the sense that allows you to have no metal fatigue whatsoever. In comparison to a lot of the other rings out there, the overall downside is the metal fatigue. So over time, as you're taking that off and on, creating your contacts, the pressure being perceived by your metal to the tooth structure is decreasing dramatically over time. So what happens there is you'll generally find your contacts to become a little bit lighter and lighter and lighter over time, to the point that you eventually end up with yourself needing to replace a restoration because you didn't provide a proper contact. Need a new ring. Contact Pro ring, on the other hand, here has came out with a really nice product that hopefully over time will have no metal fatigue whatsoever. It's also got some really nice features, and it securely fights with the nice silicone rubberized bands that they have there. Very nice wide visibility, easy to open with some of the rings, in a really nice situation. They've come out with obviously a full kit in the sense that they have the ring, they have the smart bands. In the smart band they have a coated and an uncoated. Kind of depends on what you're into in terms of the coated, the non-coated. I personally use both, but one of the reasons I really like the coated is it gives me a little bit better depth perception. I know in a lot of the bulk fill worlds and the things that we're doing today restoratively, we're asked to place increments of anywhere from 4 to 2 to 5 millimeters, depending on what type of situation there is. And it's always a tough thing to measure deep down in that box. When you have a coated band, for instance, it allows you a lot of contrast in there, so you're able to at least get a measurement. Go ahead and take a perio probe down into those depth parts and see where you're at in terms of that overall placement process. Am I close to the 4 millimeters? Am I at 5 millimeters? Where am I at? But that's really why I like those. But it comes in various options as far as the coated versus the uncoated. They also throw in some of the dry tips, and obviously they're well known for the microbrush applicator tips that have been around for a number of years that are throughout the world at this point. But a really nice kit, and encourage you to take a look at that. Here's a couple of just recent images I took in my office this last couple weeks, but you can tell how the band fits really, really tight. Now, one of the keys with any band, but especially with this band, you want to make sure that when you're placing this, is that you're placing as close to the gingiva as possible. It really locks, it gets its undercut from underneath the height of contour on the tooth structure and really locks in the tooth deep down. So make sure when you're placing, you're able to see on a buccal lingual direction as far as the overall placement being down below the height of contour on the gingival tissue. If you take a look at that image, you can certainly see how well adapted that is on the buccal and the lingual. Here's a back-to-back type situation where we were able to get some really nice contact points there, and you can see the lack of flash and the overall seal that's really nicely achieved. Very wide visibility. Had my dry tip back there, as you can see in the corner back there, pulling that cheek back, but it really does a nice job in overall isolation. There's a filling material placed into the matrix system. Really, like I said, lack of flash and contour. But the really nice thing is if you take a look at just from a buccal direction, you can certainly see how the contact is formed very, very well. It's broad, it's well based, it's got nice height of contour, and the overall achievement, I believe, is there in a restoration like that. Okay, here's your freebie for the night. So anyone that's interested, now unfortunately this is for US customers only, but if you text the word ring to 55678, they will send you a free sample of the Contact Pro ring. Also, with that, you will certainly receive the forceps, because you need the forceps that are designed for this particular band to open and close, and they'll also throw in some of the new dry tip reflectives for you to try. So really a nice gesture by Microbrush in terms of allowing some of you guys to try that. Now, unfortunately, like I said earlier, it's only limited to US customers only. So please feel free to text the word ring to 55678. I'm going to let that sit up there for just a second in case you don't have your phone. A little sip of water here. Okay. All right, so moving on. Okay, so let's talk a little bit. Now we've got a situation where we did a little bit of isolation, some alternative isolation types things, and you know, not comparing ourselves to the gold standard of a rubber dam, but some alternative isolation devices in terms of the dry tips. Now we've moved on to sectional matrix and the importance of those in a class 2, giving Microbrush prompts for that the design of that new metalless fatigue nitinol ring. So some really nice things. But now how about the bonding agents? Where are we at in terms of the relationship of gluing our materials into our tube? So if we're looking at today and where we are at today's bonding agent, how do I know what to use? I know there's things called universal bonding agents. We hear a lot about that. But when we start talking about bonding agents, I mean, where are we at today? I mean, there's a lot of things out there in terms of universal bonding agents. We hear the word selective etching type of a bonding agent. Or what generation are we in? Are we in the 8th generation now? Is it okay just to go back to my old bonding agent? If things have been working for me, is it okay to do what I've been doing? Or simply, do I need a different bonding situation for everything that I'm doing today? Where am I at in that process? And those are all legitimate questions. But the bottom line is that we all need to come to understand there's really not one size fits all. We certainly have shortcomings in all the bonding agents out there today. So if we're looking to do something different, we need to understand that there is shortcomings in everything that we're doing, no matter if we're in the 4th generation, which would simply be the 3-step total etch, or are we in the 5th generation of bonding, where that's a 2-step total etch system, or are we in the newer age, the 6th generation, which is the 2-step self-etching system, or are we in the 7th generation, single bottle, all-in-one self-etching technique. But the bottom line is, if you take a look at some of these X's in these various places, you know there's definitely some variabilities on how things work and what works best. One shortcoming for sure is the reduced enamel etching ability when we compare a total etch product to a self-etching. If we take a look at what we see on an SEM, we can definitely see that we have more of a mild acidic values when we're dealing with 6th and 7th generations, which in turn the higher the pH, the less etchability we're going to have, and the low shear enamel bond strength is obviously going to be created with the amount of lack of porosities that we can get in comparison to a direct phosphoric acid placement onto a tooth. Another shortcoming we certainly have is bond incompatibilities of a single bottle system. This is really a tricky thing in the sense that the single bottle system, we've got 5th or 7th generation. I'm talking both total etch as well as self-etching world. And really where the difficulty lies with that is the amount of acidic value that's created by placing a lot of chemistry into one bottle. When we begin to place a lot of a chemistry into one bottle and we incorporate that into a dual cure world, our compatibility issues are simply not working. And why is that? Is because the acidic hybrid layer that's created will not allow the tertiary amines that we find in a lot of our dual cure products to go ahead and polymerize and become a full processed situation. The other obvious situations when we talk about total etch is at the postoperative sensitivity. When we take a phosphoric acid of something in the 0.5 pH range and we place onto a vital tooth structure, collagen framework of a tooth structure, we certainly put ourselves into a situation where but bottom line, if we start talking about postoperative sensitivity with the total etch system, there's a lot of variables that certainly come into play when we're dealing with that. Obviously, taking a strong acidic acid to a collagen framework, allowing it to do is that demineralization and allowing us the ability to open up massive amounts of tubules and try to fill those tubules at a 100% accuracy makes things a little bit difficult. When I certainly talk about that, we talk about total etch. A lot depends on the variability in relationship to the tooth structure. Closer to the DEJ, you have certainly a less amount of collagen framework you need to deal with. Deeper restorations where you get closer to the pulp, there's certainly a lot more involvement and potential for optimal hybrid layer. End result, dealing with a tooth that's sensitive to a patient. The other thing is that a lot of these have an excessive film thickness. And the film thickness certainly can play a big part when you're dealing with indirect as well as direct restorations, in the overall sense that it gives us a limited indirect use in the sense we get poor pooling, we get caries misdiagnosed, we get some various things. And in the indirect world, when we start to try to seat a restoration that we're doing a bonding protocol, a lot of that excessive film thickness can certainly eliminate the ability us to get a complete adaptation in the seating process. So where are we today? Now these are basis off things that a couple of researchers that I follow very closely, but Dr. Fusen-Ozer and Marcus Blatz out of the University of Pennsylvania, I think they've really do a nice job in terms of overall evaluation on a fair process and give us basically a good guideline for following of what's going on out there today in America. But really one of their big things is that if you got a large area of enamel, very minimal invasive preparation, things that you're dealing with more enamel than you are dentin, then the total etch technique is still superior in terms of the ability to get a microporosities with the total etch technique in the enamel and get yourself a reliable bond. Anytime you're dealing with large areas of dentin, the selective etch technique is definitely there. and a two-bottle system superior to a one-bottle system. We'll go over that a little bit later, but really what the selective etch technique and the literature is out there, the data is behind it, showing us that certainly our bond strengths to Denton will rival anything of that in a total etch, and even be far superior to what you're seeing in the total etch world. So selective etching on large amounts of Denton, the total etch technique is more reliable on an enamel type situation. So one of the products that I've been using a lot recently, or not recently, over the last number of years, is OptiBond XTR. Now, what's the really nice thing about that is it's a self-etching, and I think that's really important when you're dealing with those type of restorations in the deeper. It's a two-component system, which doesn't mean a lot to you now, but I will tell you shortly what that is. And it's light curable, obviously, but it's got a high filler content, okay, which has a lot of nano fillers into it. Really help to buffer and give some increased strength to that hybrid layer that's so critical in our formation. Indicated, obviously, for direct as well as indirect restorations. But when we start talking about the two-bottle component system, I think it's really important, and why it's so important is this phrase that just popped up, in that we have the ability now to separate the hydrophilic self-etching primer. It allows you to separate the chemistry, so I don't have the hydrophilic as well as the hydrophobic chemistry all in one bottle. So my initial primer coat would be that etching type situation that's opening up the tubules, allowing my infiltration of my hydrophilic monomers, allowing that to set, air thinning, coming back with that separate hydrophobic bottle, the adhesive bottle that really is the sealer, the overall closer, and allows the chemistry to stay apart and also keeps an optimal pHs that we'll talk about here shortly when we talk about dealing with a dual cure situation and versus a non-compatible. So we talk about the direct bonding. Obviously, it's got indications across all the boards as far as core buildups is usually where the biggest inhibitor when I talked earlier about the pH balances and that type of thing, as well as the indirects. A lot of variables and a lot of things that this can certainly cover for you. One of the really smart technologies that they have, and one of the real advantages as well as a time saver, is that in their bottle contents they have a lot of water and acetone and ethanol, much like the others do, but they simply rely more on a process of using what we will call GPDM. So GPDM in layman's terms would be simply a phosphate ester monomer that they have created specifically for Kerr, and in conjunction with their chemistry, they allow this ability of the acetone to evaporate off, increasing the concentration of the GPDM and increasing the acidity of their overall product, their first bottle. Okay, so with that, and if you follow the instructions carefully on this, you'll notice it says a 20-second scrub time. So the real critical step on that is certainly the 20-second scrub time. Seems like a long time, may feel like a long time to you initially as you get used to it, but it's really important that you understand why you're doing it. Really why you're doing that is you're turning over that abundance of chemicals and you're creating the evaporation process of the solvents in tune, which gives you the indirect ability to promote etching of your enamel. So if you notice, I haven't added any of my phosphoric acid to any portions of the enamel. I'm simply relying on my chemistry of my bottle to create the micro infrastructure within that enamel process. After that, you go ahead and apply your second bottle following the instructions critically to create that hybrid layer. The really nice thing about the hybrid layer, like I talk about, is the filler particles they have and the ability to buffer and give some strength into that hybrid so you're able to withstand the mastications and the forces that are coming upon on a daily basis. But if we take a look at the OptiBond XTR in comparison to some of the other products, OptiBond FL being the total etch product and Clearfield SE Bond and Xenobond being the others, you've noticed that the only time we're using a phosphoric acid is on the OptiBond, and we're establishing ourselves with an enamel bond strength of 41 megapascals. The OptiBond XTR is coming in at 40 megapascals with the preference of the things are being done correctly in terms of following instructions. Here's another CR study that was done in comparison of the self-etching products and their overall enamel bond strengths without the use of phosphoric acid. And you can obviously see that OptiBond XTR did a really nice job in terms of their overall bond strengths and their research results. really what, like I said earlier, the nice thing about that is that you're eliminating some of your shortcomings when you have to deal with an extra step, increasing more time at chair side. So really a nice feature when you're talking about lack of using phosphoric acid. Okay, the incompatibility features like we talked about earlier. This is some generation testings of some various self-etching products and how the bond compatibilities of 5th and 7th generation worked in congruence with some of the other dual cure resin cements. As you can see, the OptiBond XTR tested out very, very well in terms of shear bond strength and overall compatibility. So if compatibility is an issue and you're concerned about compatibility issues in your office, it's always safer to stay within your product line if that's what you plan on doing. So for instance, if you're planning on using a Dentsply product, you may want to use a Dentsply dual cure product to go along with the bonding agent if that's the world you're dealing with. If you want the versatility and something you're not overly concerned about a compatibility bonding issue, then the OptiBond XDR is certainly right up your alley. Okay. Post-operative sensitivity, one of the things we talked about earlier is taking away and eliminating that etching, the overall phosphoric acid etching to the collagen framework. We've certainly taken that away now when we're dealing with a self-etching product that's a little less acidic, not as aggressive into the collagen framework. Very nice result. The overall film thickness, you may ask, is what is the film thickness of an OptiBond XDR? And it's 5 microns. That's extremely thin. Most crowns today are fabricated today. Acceptable would be 20 to 30 microns of openness in the margins. That was an ADA study that was done a number of years ago, but the overall consensus is you can throw that in comparison with a 5 micron opening and understand what type of film thickness you're dealing with. A lot of the other systems like a Clearfill SC, downfalls is they certainly has a nice product, but the overall downfall is the film thickness. If things aren't done properly, you end up with a really big film thickness, which can be a problem. Okay. But the overall consistent, this is some third-party testing that's been done throughout the United States in some very reputable situations, and obviously OptiBond XDR and their overall shear bond strength, both Denton and enamel bond strengths, turned out to be really, really well. This is the proof in the pudding that self-etching adhesives are definitely here to stay. If you notice the Denton outcome versus the enamel, the overall shear bond strengths are superior, which is a nice result when you're dealing with Denton, where generally majority of our failures occur at that Denton interface. Okay. So now we get a little bit about talking about filling up the hole. Okay, so now we had our matrix in place. Now we've used our bonding agent. Now we're going to talk about how we're going to fill up that hole and give ourselves some best access possible to this particular situation. So options, things we've been doing throughout the years. I mean, the glass ionomer, the sandwich technique with a highly filled composite being placed over the top. Certainly a situation that's being done today. Research, I mean, it's definitely got its pros and cons like most things do, but certainly a reasonable application of the chemistries. Okay. Then we start getting into a flowable base, a 0.5 millimeter layer to help kind of debuffer the stresses. And then from there, you can certainly get into the argument of an incremental layering of a vertical versus a horizontal. Traditional techniques that have been around for a long period of time, tried and true, done well, absolutely. But then we start talking about the bulk fills, and that's obviously a very popular situation in terms of where we're at today with a lot of marketing hype, a lot of pressure, and certainly things can be done well. But we've got certainly options that you need to understand when you're talking about bulk fill and how do these best work. For instance, if you're looking for a flowable type bulk fill that allows you to certainly fill up a majority of the restoration, but you're still going to need a capping composite at the end, that would be like your SureFill SDRs or some of those in those areas. Then we've also got situations of a one-layer full occlusal, taking that up to a full occlusal situation, and that would be more like your Sonic Fills by Curve, which has been around for a long period of time. And then we've also got dual cure bulk fill composites, certainly another strategy. But the bottom line is there's a lot of ways to handle certain situations. You certainly need to understand your particular situation and where some of the downfalls and where some of the weak points that can certainly be less than favorable outcomes. So understand what you're doing, what's your overall outcome. But one of the things I want to talk about simply was universal nano composites. Okay, so that is definitely something we should all have in our armamentarium in today's dental world. So what's so great about it? But it's a light cure composite, but it's used for all cavity classes. Okay, so for a time being, we've got a situation now where we've got a superior composite in terms of an anterior posterior restoration type, able to handle occlusal surfaces, the forces of mastication, but also able to give us an aesthetic outcome that is really favorable in terms of chameleon type effects and overall satisfied patient when the end comes to. Okay, some of the players out in the market, Tokiyama's got some products, Dentsply, 3M, Ivoclar, Kerr, Ultradent, a lot of players out here in this world and gaining some steam because I think they've certainly got. So what makes universal nanocomposite so great and what is a universal nano? Is generally made with a zirconia or a pre-polymerized type fillers, which are definitely harder than our barium glass fillers that are used in your traditional composites up to this point. The really nice thing about that is they certainly supply a superior wear resistance and definitely an improved marginal adaptation ability. Two things that obviously we're looking for in overall long-term results and long-term service is we want something that's going to wear extremely well, but it's also going to hold the margins extremely well. If we take a look at what makes these so unique is generally the particle size, and you're dealing with an 80 nanometer to 400 nanometer, depending on the material. But what they are is they're usually spherical in shape, and they allow it to come into clusters, allowing some of the resin matrix to intertwine between these, but the overall strength and the ability for what we would call plucking is a material that allows once surface hardness and material removal begins in our average chewing, our brushing process, the older type composites, we would get bigger chunks, we get bigger boulders would fall out. We'd have potholes, so to speak. And within those bigger potholes, you can obviously get more biofilm accumulation, you can get your staining, you can get obviously your filtering of your light sources as they pass through, and anterior restoration will certainly become a different means. With the new filler particles and these new universal nanocomposites, any bit of little chipping and wear results in very minimal change to the surface texture and the way these abilities of these materials to portray and hold their shine and their polish for periods of time. With these ability to pass light and the refractive index, we're finding the refractive index of most of these materials is very similar to that of enamel. So as light hits this material, it passes much like you see in enamel. The benefit to us is it allows a lot more ability to have fewer shades, I should say, because the refractive index allows these shades to cover a broader base. So if we're off a little bit in our anterior and we thought it was an A1, but it really turned out to be an A2, generally that A2, A1 composite in the nano world will pick that up and you'll have no issues in the end in terms of the overall ability to blend. And I'll show you some cases we did here a little bit earlier, but really a nice feature that we have to deal with. One of the new products out there today is harmonized by Kerr, and I've been fortunate enough to spend some time with that and do a few cases with that. But really the nice thing about that, and one of the nice things that Kerr has over a lot of its other competitors, are certainly the flow additives and the ability for the materials to adapt, much like a sonic fill. As anyone that's used the sonic fill will certainly not question its ability to adapt to the box and fill in those line angles and do those type of things. Same thing here. They've got that same chemistry in the overall process of flow well under control, but it gives you a material that's really easily sculptable and carvable. There's really no slumping, no stickiness, and able to place anatomy into various things. Now, if you're one that likes to place a lot of anatomy prior to finishing, it works really, really well. I go ahead and I don't do a whole bunch. I will certainly use some of the different burr options that we have to place some of my anatomy. But the overall consequence is you certainly want a material that's going to handle really, really well with that lack of slumping, that lack of stickiness, and just overall ability to have maneuverability and placement where you want it to be. Really, really nice feature. So, looking at a couple of the harmonized cases that I've done over the last few days, and none of it's earth-shattering. I don't mean to think that I'm the best dentist out there, by no means, but what I'm trying to show you are these are things that we do on an everyday basis. This is a particular case that a lady came in, chipped off a older filling on her front tooth, and was going to dinner. An important dinner with a business colleague, and she wanted to have that fixed relatively quick. So doing what we do best, a little bit of small preparation on that tooth, no anesthetic needed in a small situation like this. Did a little bit of a starburst pattern to help with a little bit of opening up of some of that enamel and a little bit of the overall blend process in the final result. Go ahead and use my OptiBond XTR. Go ahead and use that in a scrubbing fashion for 20 seconds, like I said, to help to, in the primer stage, go ahead and help open up some of that enamel for better bonding film or for adaptiveness. Okay. Then after that, I went ahead and light cured and everything, but then I go ahead and layer my composite. This is a straight A2. Okay. It comes in various shades of an A2E, an A2D, some extra light, a lot of components that will help cover a lot of your Vita shade gamut by no doubt. But as you can see, I began to layer that and build that into the necessary areas that we wanted. This is prior to polishing with a little bit of contouring. You can kind of see the refractiveness to it a little bit as it blends right there, but the overall color blends halfway decent. After a polish, which is a really nice feature of this particular composite, is I simply used a two-step polishing process in the Pro Gloss system by Kerr, and it was able to really establish a quick, easy shine. Did not take me a long period of time. Now, this is a patient that was worked into the schedule, so I didn't have a lot of time. But really, the bottom, after a little bit of dehydration on those front teeth, these teeth will adapt even a little bit better over the next 48 to 72 hours as we get some saturation and moisture back into those teeth. But the overall easiness and the predictability and the overall patient satisfaction is really what was nice about that. Single step, single shade, easy to use. Another case that we did just a few weeks ago was simply a diastema closure on a little lady that had obviously an opening there for a number of years. Obviously small in size. Probably would have been nice to do a little bit of orthodontics and put it in position and do those type of things. But as situations call that you all know, it wasn't in the right situation. So what were we able to do with that? I don't have a lot of photos on this, sorry, but I did some air abrasion just to hopefully clean off that biofilm. And then from there, I went and used my OptiBond XTR to go ahead and scrubs directly onto that. I didn't use any phosphoric acid. And I was able to layer in a single shade A2 composite and seal up that gap. She was ecstatic because no one was able to really get anything she wanted in there. Comparison to the other side, it's probably a little bit off in terms of size differentiation from mesial to distal, but as you can see, it's a really, really nice result that a patient was really, really happy with. Moving to the posterior, what does that look like? Now, this is a restoration that we replaced on number 4DO and recurrent decay, and we need to get that replaced. So here's the Contact Pro in place, giving us a nice adaptation, good seal, good access, good visibility. And then from there, we went ahead and used our Bond & Kevin OptiBond XDR with some flowable, and then incrementally layered our Harmonize. These are some of the burrs that I want to show you. These are some of the polishing points that I use in terms of beginning of my, this is a Raptor burr that is by Kerr in one of their logic sets. And the nice thing about Kerr is they've set up some logic sets in the sense that you can certainly buy little blocks of burrs that cover the gamut in terms of how you want to handle your composites, whether you're one that likes to do putting in anatomy with the use of a burr, or even if you just want to use a finishing kit right away, you've done most of your sculpting with hand instruments, whatever it is. There's some nice logic sets. But I like this just in terms of it allows me to put in some nice occlusal restorations in terms of the pits and the fossas and all those different things that we like to do. Another one of their bevies is a non-cutting fissure burr that allows you to, a fluted carbide burr that allows you to go ahead and place some anatomy. Here's the PDQ points that I use a lot, the brushes. There's a silicone impregnated, diamond impregnated silicone particles that allow you to give a really nice quick shine and easy to use different points, different accessibilities, things that can help you get through that in a relatively nice way. This is the final restoration. As you can tell, taking a look, you don't see any marginal degradation, no white lines, none of those things that you would see from any type of situation that had extreme shrinkage and pulling away, but really an overall nice effect. Chameleon wise, I gave it a little bit different angle. This is the same shot I showed earlier, but I wanted to give you a little bit of a chameleon effect and how the light bounces off these type of materials to give you that overall refractive index, much like enamel, and pretty much a lifelike restoration that goes relatively easy. And I wanted to say thanks again to everybody for taking time out of their busy evenings. And I hope everyone has a great evening, rest of your day, depending on where you're at in the lovely world we have today. Thanks again, and appreciate your time. Bye-bye.